At this time, we want to turn things over to Dr. Linda Degutis. Dr. Degutis is Director of the National Center for Injury Prevention and Control at the Center for Disease Control and Prevention in Atlanta. So, Dr. Degutis?
Thank you. I'd like to thank Dr. Coe and Dr. Sondic for their introductions and setting the stage for the presentation that I'm going to make here. At the National Center for Injury Prevention and Control, we're committed to saving lives, preventing violence and injuries, and lowering the health and societal costs of violence and injuries. As mentioned before by Dr. Coe, injuries are the leading cause of death among children, youth, and adults between the ages of 1 and 44, and there are approximately 180,000 deaths each year. The Injury Center has worked for over 20 years to use science to create real-world solutions to these problems, and we work across sectors with many diverse federal and non-federal partners to make people safer in all environments. Next slide. Our focus areas in the Injury Center are for motor vehicle-related injury prevention, prevention of prescription painkiller overdose, prevention of traumatic brain injury, and prevention of violence against children and youth. Our intent is to address high-burden issues where promising and proven practices are available and to be more flexible and nimble in responding to emerging issues. All of these are critical priorities that are associated with HP 2020 objectives, but today I'll be talking about our work in violence prevention. Next slide. Violence occurs across the lifespan, and we know that the risk starts at birth and continues through older ages. And we're supporting work in each area. We recently released a tool called Essentials for Childhood that documents what children need to grow up healthy and the kind of environment that they need in order to decrease some of their risks for later impacts of violence. Our National Intimate Partner in Sexual Violence Survey is the first ongoing survey of its kind in over 10 years. Data from that survey in 2010 showed that 1 in 5 women and 1 in 71 men had been raped in their lifetime. The Rape Prevention Education Program that we fund provides funding to strengthen sexual violence prevention efforts in all 50 states, the District of Columbia, Puerto Rico, and 6 U.S. territories. Next slide. There are about over a dozen objectives in HB 2020 that relate to reducing violence experienced by children and youth. We need progress in these areas, and it's critical, as we saw in Dr. Sondic's presentation, as violence contributes to substantial public health burdens for young people. We know that youth who are victims of violence are at greater risk for subsequent violence, including later perpetration and victimization. In addition, young victims of violence are at increased risk for a range of lifelong health consequences, and these include obesity, chronic diseases, depression, alcohol and other drug abuse, and eating disorders. There is also a substantial financial burden. For child maltreatment alone, the total lifetime costs for health care, child welfare, criminal justice, and the value of lost future productivity and earnings are $124 billion each year. We're focused on putting science into action to prevent violence, and I'm going to share a few examples of our current programmatic research and surveillance activities that are moving us towards reaching the HP 2020 objectives. Next slide. Having learned a great deal about what works, we have put some of these initiatives together and are using them in our STRYVE program, which is striving to reduce youth violence everywhere. For example, the blueprints for the violence prevention program at the University of Colorado has identified over 30 programs that have been rigorously evaluated and shown to be effective. The challenge is that many communities are either not aware of these strategies or they lack the capacity to implement them. So our initiative, STRYVE, is working to provide the help that communities are seeking. There are 2 prongs to the initiative. We're funding 4 local health departments to implement STRYVE. These sites are working with a coalition of folks from across sectors, including education, law enforcement, and public policy, to create a comprehensive plan, implement their plan based on the best available evidence, and track and measure improvements. We provide virtual training and technical assistance through STRYVE Online to help communities nationwide, including the communities that are funded. This includes information on what has worked and guidance on how to select, implement, and sustain an integrated approach. Next slide. Another of our initiatives is a research initiative that is the Academic Centers of Excellence in Youth Violence Prevention. We've learned a great deal about how to prevent violence, but we still need more research to understand it better. We need to understand how to help high-risk communities. This research activity is designed to reduce youth violence in defined high-risk communities by connecting academic and community resources to implement and evaluate prevention strategies. These centers take the best available research evidence, based on peer interventions, family interventions, and community interventions, and they implement strategies as part of a comprehensive approach in neighborhoods and then assess the impact on a range of youth violence outcomes. The photo that you see on this slide was taken at a community celebration with the ACE site in Colorado. The ACE team was explaining the importance of having good data to drive decisions. The young woman in the photo is holding up a sign that says, "Without data, you are just another person with an opinion." We want to stress the importance of having this data and using it to drive these initiatives. Nationwide, we know that young people of color are disproportionately affected by youth violence, and all of the STRYVE and ACE grantees are working in communities with high proportion of minority youth. For example, ACE communities are 85 to 95% minority. Rates of poverty and unemployment range from 40 to 80%. And we know that the lessons that we learned from working with these communities will allow us to better understand the partnerships and capacity required for successful implementation and the effects of comprehensive prevention strategies in the communities where these efforts are needed most.